You have talked to me a little bit
Hmm.
in the past about for some patients, you have actually
Hmm.
recommended
Hmm.
weight management in order to help their journey, and they would be
Right,
surprised. They would react like,
right.
no one's ever mentioned weight management. What are you seeing in those types of patients where you think the weight management would be beneficial?
Well, I think especially in the case of patients that have PCOS, because it's a little bit different. When you have PCOS, just reducing some calories and exercising, it doesn't always result in weight loss because there's just sort of hormonal factors and increased insulin resistance that you're sort of fighting against. So in those patients, especially, I recommend first is managing their PCOS, trying to get their testosterone levels normalized. And then I usually put them on what we talked about previously, a GLP agonist for weight loss. And these drugs, like I've said before, are magical. And I rarely use that word, but they're pretty magical drugs. And the combination of managing the hormones, reducing it, whether it's with birth control pills or spironolactone, and then adding in the GLP agonists such as Saxenda or Wegovy, I think those together is synergistic. So you have a lot of weight loss, you reduce the insulin resistance, you start improving ovulation, and so it's really nice actually when a patient comes to me 6 months ahead of time and says, I'm planning to get pregnant in 6 months or a year. So what can I do? And I would say up until, several years ago, we just had the PCOS management portion, but now we have the weight loss management, and it's very effective.